Well, I'm Jamie Smith. I'm a cancer control specialist with the Kentucky Cancer Program, and we're a state-funded program through the General Assembly out of Frankfort, and I'm actually a University of Louisville employee. We're administered through the Browns Cancer Center at the University of Kentucky, but I do have an office here in Paducah. I cover the 8 far western counties in Kentucky, and this new program we've started is planned to be tobacco-free. And so they've added a new title to me after some training. I'm a tobacco treatment navigator now as well. So this program is just going to explain a little bit about different cessation programs that are available to you. We'll talk about that one class that we can have here on site for you all. And then we'll talk about different products that are available for you and then answer any questions that you do have, okay? So first of all, the impact of tobacco. What does it have on us? We obviously know smoking and tobacco use is not the healthiest thing we can do, right? But it is something that we do. Kentucky is #1 in adult smoking prevalence, and for Kentucky, we're at 28.3%. So we lead the nation with that percentage, and so you look at that, when you think of the adult population, that is quite a big chunk of adults that are using tobacco. Kentucky also ranks the highest in the nation for cancer deaths. And so obviously a lot of those deaths are related back to tobacco use and smoking. And so we'd like to obviously decrease the number of people that we see dying from tobacco use. Health consequences, everybody comes in here every month probably and lectures you on different health things. And a lot of these are caused by smoking, cancers, pulmonary disease, cardiovascular disease, some reproductive effects as well, and then even cataracts, periodontal disease, poor surgical outcomes. A lot of times now doctors won't do surgeries at all until you're tobacco free. So we see a lot of people come into us, or if you need like a transplant now of some organ even, you cannot have an organ transplant if you are a tobacco user. They just won't put you on the list, okay? And that's just because they obviously want the organ transplant to take, and with you smoking, it hinders that it probably won't be successful. So secondhand smoke is another issue that we've seen dealt with, and that also is linked to cancer as well. But obviously you all know that secondhand smoke is a side stream that comes off cigarettes or what's left in the air. So in this room, we obviously breathe in secondhand smoke just from what people do in here. So secondhand smoke still contains chemicals, and it contains over 4,000 chemicals, and over 50 of these we know are that are causing cancer, okay? So it's not just breathing in on the cigarette that can give you cancer, it's also that secondhand smoke. So when we look at children too, not only are you worried about obviously causing cancer later on down the road, but here and now we see a lot of sickness in kids because of secondhand smoke that they breathe. And so we also have seen SIDS directly related to secondhand smoke. And so for those that do have small infants in the house, whether it's children or grandchildren or whatever, we encourage you all to have a smoking jacket. Make sure you're smoking outside the home, and to just have a separate shirt or jacket you put on when you go outside to smoke. My husband smoked when we had our first child, and he had a jacket he put on every time he went outside to smoke, and when he came in he'd take it off. But so then he didn't have to go change clothes or take a shower every single time he smoked, but he could pick the child up then, and obviously the child put up against his chest wasn't breathing in the smoke. So some other health consequences, we talked a little bit about some oral issues, periodontal disease, but also cancer, and you all are very well aware of this. But one thing that we do talk about is that gum recession. A lot of people don't think about that, but it's very expensive to have that corrected. And I mean, you're talking about maybe even a couple $1,000s if you had to go in and have your total gum recession if you want to keep your teeth. So that is a huge thing too, and insurances don't cover that as well as you probably like it to. So why do people smoke? Well, it's not that you just decide it's a great thing to do and keeps you busy, right? It's an addiction, and it's not just a habit. It's not a bad habit, and it drives me crazy at the first of the year whenever you always hear people say, you know, it's time to kick the habit or break the habit. Well, it's not a habit, it's an addiction. And so whenever you inhale on the cigarette or use the tobacco, you're obviously getting the nicotine into the system. Nicotine is what you're addicted to. That's what the addiction's coming from. And so your brain starts to develop more little receptors that say, this stuff's good, give me more. And so then you just keep multiplying those receptors in your brain, and you grow a great tolerance to it. And that's why you maybe start to smoke more cigarettes, use it more often, everything like that, okay? So if you were to try to stop, obviously you're going to go through some withdrawal symptoms if you were to try to quit cold turkey. Have either of you all tried to quit cold turkey before? Obviously not very successful, right? And that's because you're trying to just break all those brain receptors at one time, and they're there saying, give me more, give me more, give me more. So you're going to go through some of these withdrawal symptoms. And obviously some of the bigger ones you see is irritability, frustration, some anxiety, and you may be, short-tempered, especially with some family members that you're around every day, or co-workers. And so sometimes it's just easier to go pick up another pack of cigarettes and start smoking again, right? Because that will take care of all those. So how do we successfully treat tobacco dependence? And nicotine has actually been proven to be more addictive than heroin and cocaine. So when you look at a heroin and cocaine addict, where do they go to break that addiction? Right, to a rehab of some sort, right? And so they're completely taken out of their environment. They're put into a secured facility where they're safe for up to 6 months or longer even, maybe. And their addiction is broken inside that. Then they're released back out into the wild, right? Well, with these classes that we're going to have for you all, you guys are going to continue to work. You're going to continue to live your normal life and everyday stressors, but we are going to help you with that addiction side and then the behavior sides, okay? So it's twofold. You need the medications for cessation, and you need the behavior change program as well. And so this program that we're going to use will encompass both of those into that to help you be successful. Another big thing right now on the market is e-cigarettes, and there are some doctors that will encourage their patients to do this, and then there's some that don't, okay? Because it's still nicotine you're still getting from it, so there's still the addiction there. And we still don't know exactly what is in every type of e-cigarette.
We've getting nicotine from those also?
Yes, you're still getting nicotine from them. Yeah. And the thing that's alarming right now with this is that there's no FDA regulation on them whatsoever. The FDA hasn't said, good or necessarily totally bad on them yet. But what the FDA has found so far, preliminary findings have found that some of the cartridges contain carcinogens in them, okay? So and it's still some impurities. You maybe not be getting the, over 6,000 chemicals that you're getting from a cigarette, but you're still getting some dangerous chemicals in that. But the thing is that not every e-cigarette contains the same thing. So we're not for sure what chemicals are found in each one. And there's over 250 types of e-cigarettes right now. And some of the flavored cartridges may contain up to 20 milligrams of nicotine, which is more than what you get out of a regular cigarette. And but what it's kind of branded as is that you start out on a high dosage and it kind of filters you down. So a guy in here yesterday was smoking one, and he said that it is regulated. And I don't really know what he means by that, because right now the FDA does not regulate it. And we're not for sure if there's an exact measurement of nicotine and everything in there. But what I would assume he meant was that he started out at a higher dosage, milligram-wise, of nicotine, and he's slowly stepping down. He's on the lowest one now, which he said was 8 milligrams. So, there's a lot still to be known about e-cigarettes and what it is. So some people have quit smoking with it, but whenever they say that they've quit smoking, they're still using an e-cigarette. So you still have that addiction to the nicotine. So the goal, obviously, if you're going to step down with that, is to eventually stop using the e-cigarette as well, okay? So we'll see. I think this year we're going to learn a lot more about e-cigarettes from the FDA and kind of know a little bit more about what they're actually putting into them. So we'll have better knowledge of all that. So what are some other ways that can help you throughout the quit process and what has been proven, right? We want stuff that's been proven. So first of all, there are quit lines, and these are available to everyone in the United States, but Kentucky has one that we use, and it's called Kentucky, Quit Now Kentucky. There's a handout on your table about it. But what this does is it's free. You can call between the hours of 7 a.m. and midnight our time, and 7 days a week. And there's a coach on the line. They'll talk to you. They'll talk to you about your quit date, talk to you about what kind of nicotine replacement therapy you should use. They'll help you pick your quit date. And you can have up to like 5 calls with them where they kind of sit down and coach you through the process. So that's available as well. There's a website too, which this is their homepage, a picture of it, and you can actually enroll online too. So if you were to enroll online, you would leave like a number that they could call you back, and that coach would call you back at some point to enroll you into the program. There's also a few other websites, smokefree.gov, which has some great information on it, and then becomeanx.org, which is an online, totally online-based program, and they do forums, so it's kind of like a little chat room you join. You type in your zip code, and it connects you with other people in Kentucky or around us that are trying to quit as well, and you can talk to them, and then there's some experts on there too that can ask questions. And at one time they had a specialist from the Mayo Clinic who would check in once a week, and you could do a live chat with him. So that was pretty neat. And he's actually from Murray, Kentucky. It was Dr. Richard Hurt, and he's originally from Murray, but he's an expert in tobacco. So the National Cancer Institute also has a new online chat forum. So you know when you go to like a website and you need that technical support and you can type in and talk to somebody immediately? This is what this is like. There's a little box you would type in, and you would be able to talk to an expert or counselor on the other side of the computer, and they would talk to you and help you, okay? So if you like to be anonymous, some of these are good stuff. There's also a new Facebook app that you can get if you like that kind of stuff computer-wise, and there's always an app for everything. But this is called the Quit Lab, and so that's online. And right now it's just started. It says it's part of a 3-year project, so we don't know what it'll prove to be. But so it's kind of in the infant stages right now. So, and I honestly haven't gotten on it to check it. Then this is the Cooper Clayton method to stop smoking. This is the program that I was talking to you about that we could do here on site with you all. It's a 13-week program. The first week is an introduction week. You simply just come and learn about the process, okay? Then we'll have you track the amount of tobacco you use that next week. When you come back the next week, we'll look at when your triggers are throughout the day for your smoking to see when you peak and when you don't. And then we'll talk about your quit date then and what nicotine replacement therapy you want, and then we'll pick your quit date, okay? So for the first 2 weeks, you're kind of still smoking, okay? You don't quit right away. And so we're gonna try to offer these right after we come back in the new year. So we're looking at maybe like the first full week of January, trying to offer these on site here. And I would come here and do those once a week, probably in this room, okay? And like I said, it's a video I show, and then we talk, and I'll give you all handouts and give you all some ideas, and maybe bring a few things to be able to show you all what other things you can do besides smoking or using tobacco, okay? And the good thing with Cooper Clayton is, especially when you do it in a work site, I've told people I've had a tremendous success rate with Cooper Claytons in work sites. And I think maybe part of it is because you've got kind of a buddy system. You know, you're with these people at work more than you are with your family, to be quite honest. And so to be able to have that accountability every day at work, you know, you guys are going through the same thing every day, and you know what each other's dealing with, and obviously you've got home stressors too, but really this is who you talk to every day, and so it's a great support at work to be able to do it. And so the success rates have been really, really high with the classes on site. So we're looking forward to be able to provide that here.
Now you said you have these classes offered on days also?
Yes, we're going to offer them. We'll offer them twice a day here. We'll offer them for the first shift, and then we'll offer them for the second shift.
What time were your classes on days?
We haven't picked them yet. Yeah, so we don't know yet, but.
Too early, I was not coming to day class that way, you know, I'm up here with us.
With your work?
Right.
Well, she talked to HR, and they're willing to pay you all to come to the classes. So they said that you all can do them while you're on the clock if you wanted. So that's pretty good that your employer is willing to do that. So But yeah, she'll definitely advertise it in time so you'll know what time it is. So if you wanted to come to that first class in the mornings, you could, or if you just wanted to wait and come while you're on shift, you could do that too. Some risk, obviously we talked about a lot of these earlier, but causing cancer, heart disease, other different types of pulmonary issues, macular degeneration, and then obviously we talked about some of the reproductive things. Rewards, you all know that obviously you're going to immediately get a reward to your body by quitting. Improved health, and this first handout that we have here talks about even within 20 minutes of stopping to smoke, how much the level in your blood changes with the carbon monoxide. And then it talks about, or your heart rate, changes within 20 minutes. And then up to even 12 hours, and then all the way up to 15 years. And when you get to that 15-year mark, you're actually looking much more like a non-smoker. So your risks are almost back to that of a non-smoker that have never used tobacco. So, but your children will be healthier, especially if you have children in the home and you're smoking in the homes, or if you're smoking in the cars with children too, you'll see a change in that. And then skin wrinkling, obviously we see that. And then my biggest thing too is whenever I start a lot of classes, a lot of people are almost gray looking. Their skin has a gray tint to it. And by the end of the class, it's more pinkish and flesh tone because obviously more oxygen is getting into their body. And then the biggest one, which everybody loves, is the financial gain you get from that, which we just talked about, before. You all know how much you're spending on it. This can tell you how to obviously calculate the cost. And so we did this yesterday with a guy that smoked 3 packs a day. And the average cost we figured was about $4.75 for 1 pack. And so we multiplied that by 3 and then by 365. And it was a little bit over $5,200 a year he was spending on tobacco products. So I said, what could you do? Give yourself a pay raise of $5,200 a year. That's a big difference. I said you could go rent a beach house, for that much money. So there are some medications that are approved. There's some that are by prescription only, and then there's some that are over the counter. And so we're going to go into detail about those. In that handout that I have on your desk, there are 2 tests on there. They're the Fagerstrom test for nicotine dependence. There's one for smokeless tobacco, and then there's one for cigarettes. So you would pick whichever one you use, or some people used both yesterday. They did both, and so they would answer the questionnaire. The closer your number is to 10 on the score, the more dependent you are upon nicotine. So that just shows us that you do have a stronger addiction. Okay, so it's good to know whenever we start the classes. So why would you want to use nicotine replacement therapy? Well, obviously we talked about brain receptors. Nicotine replacement therapy helps break those receptors down in your brain so that you can go back to those that would be like a normal without any nicotine receptors in the brain, okay? So it also can double the quit rate, so it's a lot more long-term. When we look at long-term relapse, it gives you a better chance of staying a non-smoker. The only NRT precautions we have are anybody that may have an underlying cardiovascular disease, and all we would do with that would have a doctor just say that you are okay to take the nicotine replacement therapy in the amount that is directed. And so we talk about that though in class, and we talk to Tish, and either one of the doctors over at Healthworks would be able to clear you on those, okay? So it's not that big of a deal. Nicotine gum is one that is available over the counter. This is one that we would use in the class. We use the gum, Lozenge, or the patch in the Cooper Clayton classes. And then, like I said, I've had some other people come to the class just for support that are on something else, but these are the 3 that the doctors really encourage us to use. So nicotine gum is first. 2 milligrams and 4 milligrams is what it comes in. And whenever we do the class, we'll talk about which one you would need to take. So basically for the gum, this tells the dosing level, but whenever we do Cooper Clayton, Dr. Cooper and Clayton kind of give you a different dosage schedule. So that's what it's scheduled on the box, but in the class we do it a little different. Basically what you do is you chew slowly, you'll get like a peppery taste, and you'll park it between the cheek and the gum. It's absorbed through the gum line, and then when you kind of feel the sensation stop, you will pull it back down, chew it for a few more seconds, and then you'll park it again, okay? And then eventually you'll kind of feel that the nicotine's gone out of the gum and you can, dispose of it. So the one big thing with this is the effectiveness of it is affected by some foods and beverages. So you have to have a pretty neutral pH balance in your mouth. So 15 minutes before you start, you would drink some water just to neutralize your mouth. And then we would say no eating or drinking while you're using the NRT product, okay? So some advantages, you can kind of manage whenever you have the urge. Obviously you can put a piece of gum in your mouth to kind of take that urge away for a cigarette. Some disadvantages, obviously if you had some dental work, chewing gum may not be the best thing for you. And then also we see that we tend to underdose with the gum, and then as Americans, we tend to chew gum, not just kind of casually chew on it. I've seen some people, I had one person come through line, it was a nurse at one of the hospitals, and she came through and she told me that she was addicted to this nicotine replacement therapy gum, and I said, "You are?" And she said, "Yeah," and she was just chewing away on this gum. And I said, "Are you chewing it right now?" She said, "Yeah," and I said, "Well, I don't really know that you're addicted to it, because whenever you chew gum, it produces saliva right in your mouth, so you swallow. So when you swallow that nicotine, it's not going to be absorbed as well through your stomach as it is through that cheek and the gum." So she was only getting like 20% of that nicotine from that gum instead of, up to like 80-something% that you can get through the gum line. So I said, "You're better off just going to the store and buying, like Big Red or something and chewing it for the day if you just want to be able to chew." So, and my husband tried to use the gum whenever he stopped smoking, and he was doing the same thing. He chews gum all the time, and I said, "This isn't what you should do because you chew gum too much." So it didn't work for him either. So his addiction wasn't as strong though, and that Fagerstrom test showed us. But my husband could be off work and he wouldn't touch a cigarette all day while he was home. It was while he was working, and he drove around a lot. He's a police officer, drive around in his car, and when he was on patrol, and he wanted to smoke all the time when he was in his car. It was just the hand to mouth while he was in the car.
Just like down here, I mean, a lot of it deals with nerves.
Yeah.
I think, like you said, because, constant turmoil, get this done, get that done.
Mm-hmm.
First thing you do, reach for a cigarette.
Yeah.
To kind of give you that relaxed,
Yeah. And it's just like you said too, he may have not actually really smoked that cigarette while he was driving either. It may just been lit, held out the window,
Yeah.
but it was just kind of that clutch,
You'd be surprised just walking around in NASCAR, how many cigarettes on the dock screen or in a ashtray. There's nothing even took off of them.
Right.
They just light them up.
Yeah. Yep. Yeah.
Now, let me ask you, as far as tobacco, now do you think the chemicals in tobacco actually, and I've dealt with tobacco all my life, there's so much spray now that's come out, it's more poison than it used to be years ago.
It's the additives that they add to it whenever they actually roll the cigarettes.
Mm-hmm.
Yeah. And because a lot of the tobacco we grow in Kentucky isn't even used for cigarettes; it's used for other things.
Right.
So it's not necessarily just that, but a lot of it is whenever we actually smoke it, it's the additives that are in there that they even add more, carcinogens to it. Now, I mean, some of the chemicals that you spray on all plants, aren't the healthiest thing for you. So. That's why a lot of people are all into this organic thing now, but still with organic, you still got to be careful with that too. So, but yeah, it's especially those additives that are added to cigarettes that make it even much more detrimental.
To make more people smoke.
Yeah, probably. Yeah.
You smoke more.
Yeah. And then, they always say like the difference between light and regular. Well, there's another ventilation strip through the lights, but when you put that cigarette in your mouth, you cover up that extra row of vents. So if you're smoking lights, you're really smoking regulars because you're covering up that extra layer of vent anyway. So you may be paying extra for the lights, but you're still getting the exact same amount you would from a regular. Yeah. The nicotine lozenge, it comes in 2 milligrams and 4 milligrams too. It's over the counter, it delivers about 25% more nicotine than the gum. And so a lot of people are highly effective, highly successful with this. Again, with this, you moisten and park it. And I've seen a lot of people that use smokeless tobacco that are really successful with this because they're used to kind of parking that between their cheek and gum. So there's different flavors, and we'll talk again in the class which one you would need to use. But with it, again, you just kind of roll it, you'll get the peppery taste, you'll park it, and then you'll bring it back up when needed. Now this says the lozenge will completely dissolve within 20 to 30 minutes, and I've never known anyone that can ever get rid of it that quickly. And you would probably have to roll that quite a bit to get that. Usually, I've had some people in class that have had it for up to an hour and 15 minutes in their mouth. But usually on average, it's anywhere from like 40 minutes to an hour it takes to dissolve that. So it does take a little bit longer. The pH level is still very important for the mouth, so you still have to make sure that you rinse with water and then no eating or drinking while you have the lozenge in your mouth, okay? There are a few side effects to this. Most of those are GI issues such as nausea and hiccups and heartburn, but usually those do go away once you get used to the product, okay? Nicotine patch, I call this kind of the dummy proof. You don't have to think about it. You just get up in the morning, you put the patch on, and you go through your day. And there's a time release on that patch that will let out the medication into your body, so it's done itself, okay? With the patch, we'll show you later, the Nicoderm CQ has been studies done where it shows exactly the time release on it, and so it peaks within the first hour you have it on, and then it slowly tears off. And it usually takes about 8 hours for it to kind of really start to get back down to the level where you might need a cigarette, and then it gets down to that level when you're going to sleep. So it keeps you comfortable while you're asleep, and it'll kind of fall off a little bit more, but then when you wake up in the morning, you might, first couple of days, you might say, I need a cigarette, but you know it's time to change that patch. You just need to get a new patch on, okay? You want to rotate that placement. You never want to put it in the same place in one day, or in more than one day. And so you will put it anywhere from the torso above. And what I like to tell people to do is just start on your arm here, and then just find a different place, find 7 different spots on your body where you're going to put it, okay? And move it around each week. So for some guys, it may be an issue if you've got a lot of hair on your chest or your back. And so for maybe a couple weeks, you may need to just shave some extra spots just to make sure that you get that patch really good and absorbed into the skin. Some of the things that you may see, this shows actually taking the backing off the patch and then, oops, I hit the wrong one, and then putting it down. And it says to kind of press firmly for about 10 seconds. And during the summer, that's especially important when you're hot and sweaty. You know, you want to make sure that you do get that on there really good. The other thing is if you do use it and you do get hot and sweaty and you find that it's kind of sliding a little bit, if you'll just take like the brown medical tape that's kind of loose, you know, you can wrap that extra around your arm just to kind of hold it in place. And that's proven to be pretty good as well. Whenever you take the patch off, you want to fold it in half because there's still nicotine in that patch and you don't want any pets or children to get a hold of that in the house. And then obviously you don't want to like rub your eyes or your nose whenever you're doing that. Never cut the patch. Some people try to cut it in half to, you know, get less, but that disrupts the time membrane release on it, and so it's not going to be as effective, okay? And these are some of the side effects you may, most of the people I ever have are just some little skin irritations, but as long as it's gone within 4 days, you should be okay. If you have something more than that, you probably do have some sort of reaction to that adhesive, but if you can wear a Band-Aid and you're okay with Band-Aids, you'll be okay with a patch, okay? Then there's the nasal spray. Now this is available only by prescription, so you'd have to go to the doctor or to Healthworks to get a prescription for this. But you have to prime the pump before you ever start to use it. This is actually highly effective when used properly. Dr. Cooper has given some great statistics with this, but there is, you do have to gradually taper off of it as well. There's also a higher addiction rate to this. People can become addicted to the nasal spray. But this shows how to obviously take it apart, and then it talks about priming it, then tilting your head back, and to press that in there. Then you don't sniff or inhale while you're doing it because it needs to absorb through the mucous membrane right inside the nose. And so if you feel like it may be dribbling out, you can kind of just gently brush it back up into your nose by sniffling lightly. But wait 2 to 3 minutes before you blow your nose. And then it also advises to wait 5 minutes before driving or operating heavy machinery because you can get some tearing and some coughing or sneezing from it. And then obviously if it gets in your eyes or your mouth, you want to rinse, okay? This shows a lady using it the correct way. And then these are some things you can expect from it, which you may experience with any type of nasal sprays that you use. Obviously, again, it's easy to self-medicate with this. When you have the urge for a cigarette, you can easily administer a spray into your nose. But then, like I said, there is a higher dependence potential upon this, so there's a caution with that. The nicotine inhaler, this is also available by prescription, and this is something that I've seen several people use. My grandfather used this for years. My grandmother would kind of go through stints where she would allow smoking in the house and then she wouldn't allow smoking in the house. So I always knew when Grandma didn't allow smoking in the house because my grandpa had one of these in his mouth whenever we walked in the door. But then when he'd go outside to the garage or outside, he would have his cigarettes out there and he would just smoke a cigarette. So this still has the hand to mouth, so it doesn't actually kind of break those behavior parts of it. So it talks about how much milligrams is in there, and it will deliver 4 milligrams of nicotine, which again, absorbed through some mucus. Now, this tells you during the first 3 to 6 weeks that you're going to use at least 6 cartridges during the day, and recommended to use it for up to 3 months, and then you gradually reduce the amount that you use, okay? So this isn't a long term, which some people do use it for long term, kind of like the e-cigarette thing. This shows the markings that are right there together. Those have to be together to be able to pull the piece apart. And then once it's apart like that, you insert a cartridge. When you press that back together, it breaks the seal in the cartridge, and then you twist it so those marks don't line up anymore, and then you can inhale it just like you do a regular cigarette. And if you were to puff on it pretty actively, it says 20 minutes, and you're going to deplete what's in that cartridge. But if by chance you didn't, an open cartridge would still have nicotine in it for up to 24 hours. So the mouthpiece is reusable. You don't have to get a new mouthpiece every time you have a cartridge. You can clean it, okay? So again, temperature plays an impact in this too. So if you guys were outside here during the winter, it probably wouldn't be very effective for you because you're not going to get enough nicotine from that. It still says too not to eat or drink, and to drink water 15 minutes before you start it. Again, you can easily medicate yourself. If you feel the urge for a cigarette, you can easily use the inhaler. And then there are obviously some disadvantages, but working in the code's probably one of those biggest ones that would be effective for you all. The FDA has approved some combinations of over-the-counter medications and some of the prescriptions. And what we would do is we could talk again to Healthworks, and they could agree to give you all an extra prescription if needed. The biggest one I've ever seen used in classes, what we've used is the patch together and a product called Zyban, which we're about to talk about. This is basically a antidepressant. It's the exact same drug as Wellbutrin. You may have heard of Wellbutrin. And so basically what this does is it takes off that edge. So if I've got someone that's maybe a 3-pack-a-day smoker that's been smoking for 36 years, that's a pretty high smoking addiction they have there to the nicotine. And so sometimes they just need a little something extra to take off that edge part of the day. And so by them taking Wellbutrin in the morning, that helps them throughout the whole day, okay? And it may just be something as simple as that. I've also had some that have taken like the patch and maybe added a few lozenges throughout the day with the doctor's approval for that. And so just during the day, they may take 3 or 4 lozenges when needed. Anybody that should be warned against the Zyban is anybody with a seizure disorder. If you're already taking Wellbutrin, obviously it's the same drug. You're not going to take Zyban too. anybody with a prior diagnosis or current eating disorder, and then anybody that is trying to rehab from alcohol or sedative addiction, okay? There is a black box update to Wellbutrin or Zyban. Some people have worried about some of the suicidal thoughts too with this one, but what we've seen is that there's an increased risk in children and adolescents and young adults, but it's kind of different for adults over 24. It's kind of neutral, and then it's a decreased risk for anybody over 65. So they've said that this is pretty safe for you to do this. And again, all antidepressants kind of carry that same warning, okay? So we talked a little bit about some of the reasons why you shouldn't, anybody with certain disorders, and then also it lists on here with severe cirrhosis of the liver, maybe some sort of psychiatric disorders, but you're probably going to be on some other medication for that too, and some of the brain trauma. We may have had some of that. So initial treatment, it talks about you take one every day for 3 days, and then twice a day, weeks 7 through 12, and then when you go to 2, then they need to be within 8 hours apart. So you'd obviously take one in the morning and then one later at night before you went to bed. Common side effects: insomnia, dry mouth, and then some skin disorders, rashes and things, but those are very, very uncommon. There isn't a tapering with this, so you don't have to slowly wean yourself off of this medication when you do decide to stop, okay? Now this is Chantix, and so we talked about this a little bit before we started, and so you know what this is. Some common side effects, like I said, nausea has been the biggest one I've heard of, also insomnia, and then with this it shows the pills. This is the dosage. Day 1 to day 3 you take 1 pill, then day 4 to day 7 you increase that to 2. This is while you're still smoking that first week. Then on day 8 is when you quit smoking and you move to 2 pills of the 1 milligram, okay? And again, like I said, sometimes a lot of doctors aren't prescribing this anymore because of this warning and precautions that are out there now, the black box warning. And a lot of hospitals too aren't allowing those to be given in hospital settings anymore either if you're inpatient. So obviously there has been some suicidal ideation, homicidal ideation, and there have been some attempts that have been directly related back to this. So it's just something for you to talk to your doctor. There's always a side effect with every medication that you might take. So the advantages, obviously, for those that it works for, it's easy just to take 2 pills, right? A magic pill and be done with it. But then obviously some disadvantages. So that post-marketing surveillance data is probably the most alarming that we're looking at right now. So why do NRT? Like I said before, think about if you're standing on the top of the cliff. Would you rather, slowly take it down, rappel down slowly? So like that's what nicotine replacement therapy is. You're slowly rappelling down off a cliff, or quick cold turkey and you're just shooting straight down, just diving right off. So obviously the nicotine replacement therapy is going to help break down those brain receptors and give you a better chance at becoming smoke-free and nicotine-free. There is some slight weight gain with smoking cessation. We see that a lot, but basically when you quit smoking, you need to burn an extra 200 calories a day, okay? So that's why it's on average, it's usually 3 to 5 pounds that you might gain. But if you were to just increase adding 30 minutes of walking to your daily routine, that would be enough to supplement those 200 calories, okay? It's just 200 calories. So you either need to cut 200 calories from your diet or increase exercise to burn off an extra 200 calories. This shows the pricing of the NRTs that are available. And so this is pretty much the average cost of cigarettes when they're not on sale prices. And so you can tell the patch is obviously the least expensive. And so you'd be immediately saving money with nicotine replacement therapy, especially if you smoke more than 1 pack of cigarettes a day. So some of your typical triggers, usually it's wake up in the morning, you go get coffee and you smoke a cigarette, right? Okay, so during these, we might talk about some other things you would do first in the morning, so that's not that initial just kind of regular routine that you're going to do. We're going to mix up your routine just a little bit to get you out of your normal cycle, okay? So you may need to go take a shower first, then go get your coffee and read your newspaper, and maybe you need to eat an apple or something in the morning with that instead of smoking a cigarette, okay? So there's things like that we'll talk about and work through. Some people realize that when they're in their car, immediately when they get in the car, they light up, or whenever they pick up the phone, they light up a cigarette, especially if you smoke in the house. And Dr. Cooper will joke around in training. His biggest trigger was whenever his wife would hand him a to-do list and he knew how to do nothing on that list. You know, he would say, I'm going to quit, and then she'd give him the list and he'd go buy a pack of cigarettes because he'd have to figure out how to do what's on that list, and he needed a pack of cigarettes to be able to help him do that. So we go through all that and help you, okay? So the question is, how many times have you quit before, tried to quit?
I quit for 2 years.
2 years?
Yeah, I quit for a year and a half.
Year and a half. And see, so like my husband, he quit 5 years ago, and we talked about this last night after I did the classes here yesterday. And his biggest trigger for a long time is if you ever heard anybody packing a pack of cigarettes, he would think, gosh, you know, I really want that. So I thought he had smoked cigars since he quit smoking, but he informed me last night he has not smoked a cigar even since he quit smoking, because he's scared that will put him back into the frame of he'll just go smoke one cigarette and be done, and then he'll get that back. But it's funny now because when he's around somebody that smokes, he coughs. He's found himself more agitated by smoke than he did whenever he smoked. And I guess we didn't really pay attention to it whenever he was a smoker. But for him, he ended up getting sick 5 years ago, really, really bad, 5.5 years ago, and threw his pack of cigarettes out of the car on the West Kentucky Parkway around Litchfield. And I had to go pick him up at Beaver Dam. He was so sick he couldn't drive. Me and my dad had to drive up there and get him. He was coming from Louisville. And he was in bed for 3 days, didn't move, didn't even get up to smoke. And so he initially got through those first 3 days, which you know were the hardest. And so at that point, he just said, I'm just not going to go buy another pack. So for him, when he went back to work and he was in the car, he tried the nicotine gum, which wasn't really working very well for him. And his was more of a hand to mouth. So he did blow pops for like 2 weeks, you know. Of course, he got some sores in his mouth because he was sucking on those suckers like his life depended upon it. But once he initially got over, like I said, those kind of behavior changes where he didn't automatically reach for a cigarette in his car, he was able to get through that. Because he would be home on his regular day off and he may never go outside and smoke a cigarette. It might be like 10 o'clock at night and he's like, well, I haven't even smoked a cigarette today. I need to go out and smoke one before he went to bed. So, you know, his dependence wasn't as big, but it's knowing these things of what your triggers are, and when you really feel like you need to smoke makes a huge difference whenever you're trying to quit. So a lot of people, on average, we usually have people that try 3 attempts or more before they are successful. So you never want to beat yourself up just because you fail once. And just because you maybe quit smoking and then you have 1 cigarette, you're not a failure. You haven't broken the wagon. You know, you can get back on, okay? So we really want to encourage people not to feel bad if they do happen to slip and have a cigarette, okay? Just what happened in that instance and how can we help you for the future if you were to put in that same situation again, what are some other choices you could have made, okay? So are you all ready to quit now? Or are you just like, I'm not ready, I don't want to do it? And that's fine if you're not. If you're not ready, that's fine. Are you thinking about it? If you're thinking about it, I encourage you to come to at least the first introduction class of Cooper Clayton just to learn a little bit more about it. And then, you know, if you are planning on quitting, when is the time frame? You know, if it's within the next month or so, Cooper Clayton might be a good option for you to come try. If you're wanting to wait a little bit longer, then let's see how the first classes go, and then if we offer it again, maybe the second time, you know, you might be ready at that point. But like I said, you know, come at least to the introduction class, learn about it, and see if you think that it might work for you. So Cooper Clayton method, we usually have about 40 to 50% success rate when you look long term of relapse, of non-relapse, and so that's pretty good, pretty good. When you do your quit plan, we'll pick your quit date. We'll talk about, obviously, Cooper Clayton class. If you're in here, then you'll have myself and doctors that can help you, including the access to the doctors at Healthworks. And then we'll give you some skills and behaviors that can help you. We'll help you pick your NRT that you're going to use, and then we'll help you prepare for it. We're not just going to throw you out and say, pick your quit date, and you're going to start tomorrow. We work with you on all that, okay? and getting your home ready and your cars ready and all that good stuff. We kind of go along with that with you. So tobacco is the single greatest preventable cause of disease and premature death in America today. And this is just a little funny, you know, you always see that commercial in the packs. Everybody recognizes that. But you never hear them saying this, but I miss my lung bob.